Making a difference in healthcare requires collaboration between researchers, startup founders, and policymakers. This is what Delta is about, hosting conversations with leaders on the path to serious innovation. Hello everyone, my name is Rupen, and I'm a physician on a journey to meet people who are making a delta in healthcare. Hey everyone, welcome back to the show. And today I want to talk about the interesting study that was published recently, and I really liked the methods. It's about using AI in helping physicians answering patient queries. So the name of the study is Artificial Intelligence Generated Draft Replies to Patient Inbox Messages. And it is published by Dr. Garcia, and the study was done in Stanford. It is very interesting study, and let's talk a bit about the background. Let's explain why this is important study to see if AI can be used in this type of tasks. So I want you to think about physicians do two types of tasks. One are creative, which is about thinking how to treat patients, and the other is repetitive, writing emails, sometimes even like putting orders in, doing administrative things. And furthermore, when we also get bombarded by tons of messages that patient ask, this can sometimes fall also under repetitive tasks that we can use AI to help, not replace, and this is very important, to help physicians in tackling this. So physicians in this day and age are bombarded by tons of messages and information. So as a physician, I get messages from my patients. It could be emails. It could be they might page me and they can reach out to me. And also, like for systems that uses Epic, patient can send questions to their physicians through Epic and or other electronic medical records that permit patients to message their physicians through the platform. And the study wanted to see if there is a use of AI where it can help physicians in generating answer directly to patient queries without putting much thought in it, without drafting the answer, where the AI generate the answer and then physician supervise and says, yes, it's okay, send this answer to the patient. So what did they do is they went to clinicians and nurses and asked them, hey, do you want to participate in the study? And it's important to note here that the study population is not only clinicians but nurses, because like documentation and sorting out these messages takes a full team. For example, like if one of my patients is going to page me or they're going to call me, this call goes first to the clinic and then one of the nurses answers the call or read the fax or read the message, and then she forwards this to me, and then I reassess. Usually if the nurse can answer the message, they can respond to the patient. If not, they will let me answer the message and respond to the patient. So as you can see, patient-related queries usually are answered by more than one healthcare providers. So they included nurses and they included the physician, and they said, hey, like if you complete this study, you're going to get a $20 gift card. So there is some small financial incentives, nothing a lot. But the interesting thing is, how did they measure if clinicians or nurses would use such AI model? They did that through a survey. So they gave the clinicians and the nurses who completed the study a survey before and a survey after, and they measured several things which are going to talk about. And they integrated AI into the electronic health record, and it looks like in Stanford they use Epic. So they used two models. They used GPT 3.5 Turbo to categorize the messages into 4 groups. And then they used GPT-4 to generate a draft of these messages. And the reason the authors say that they use GPT 3.5 because it's cheaper, and it looks like that GPT 3.5 did a good job in categorizing these messages into different groups. The groups were general, results, medications, and paperwork. So it depends on what the patient is asking for. Are they asking for the results of the recent blood work? Are they asking if they can take this medication? Are they asking the physician to fill up insurance or a claim? Or if it's something that did not fit into these 3 categories, it was categorized as general. And the others do a good job also. If you go to the supplementary material, they leave a nice figure there where they can show an example. So here in the example, if you go to figure 2 in the supplementary material, one of the patients is asking the physician, so in the message they say, "Hey, Dr. Walker, I forgot to tell you that I'm a new grandpa. She's adorable, but also is frequently sick. Do I need to be concerned that being around her germs will hurt my aortic valve?" And then the generated draft was, "Hello, George. Congratulations on becoming a new grandpa. It's wonderful to hear about your adorable granddaughter. Regarding your concern about your aortic valve, it's important to maintain a good hygiene practices, such as washing your hands frequently and avoiding close contact if she is sick. However, if you have specific concerns about your aortic valve or your overall health, I would recommend scheduling an appointment to discuss this further. Please don't hesitate to reach out if you have any more questions or concerns. Best, Dr. Walker." So, several comments on this message. It's nicely drafted. Like, it acknowledges the patient, like, "Hey, you became a grandpa, congratulations." And I should admit, as physicians, sometimes if you are rushed in the clinic, we might even forget to say to the patient, "Congratulations for your for being grandpa," or like, "Sorry for your loss." We might just answer their queries. And here, no, the AI model or the GPT-4 took into account that, "Hey, I should congratulate this person." And the answer was very clear and very accurate, I would say. That's correct. Like, if the granddaughter have a sickness or something, the grandpa should stay away from it, because like if they have bacteremia, which is like spread of the bacteria in the bloodstream, it can affect the aortic valve. And the nice thing about the generated answer was, at the end, it added "Best, Dr. Walker." So it wrote the physician's last name. If I'm going to draft a letter like this, I would say it takes me around a minute, because like usually for those people who don't know how we type, actually we don't type in healthcare. We dictate. Mostly we dictate. We do type, but it's like 10% for me at least. So I have to take my phone out, and then I have to open the Dragon Dictation app, and then I have to open the app, and then there is a lag time when the phone app synchronizes with the electronic medical record. So that's like 5 seconds or maybe less. Maybe I'm exacerbating. It's like a couple of seconds, but still it's frustrating. And then I have to dictate the letter, and then like I have to read it. Usually 99% of the time there are no typos, and then I have to send it. So I would say like generating a draft like this, it took around 3 minutes, maybe more, okay, but let's be conservative. But that's still good time. Like if I have 10 queries by 3 minutes, so that's a 30 minutes saved in my day, just making sure. So how I do save this time, like I'm still reading the message, but I'm supervising the message instead of typing the message, and that takes less mental load. And this is something that people who don't work in healthcare maybe have difficulty to understand, but literally we get tired in working in healthcare sometimes, not because of we are physically tired, but because it mentally can drain your brain, because like you take tons of decisions and you write tons of paragraphs and you dictate a lot. Looking at the results, and I find them interesting. Over a 1 month period in Stanford, they were able to enroll 197 clinicians and nurses and physician assistants. We're going to talk about this in a second. But out of the 197, only 162 were analyzed in the study. Some were excluded because like they were on a vacation, they were not there, or they worked like in a non-ambulatory roles. For example, like if they were rounding in the hospital that time and they were not in a clinic, probably they were excluded. And out of the 162, finally, only 73 clinicians completed both the initial and the final survey of the study. So it was only the physicians who complete the survey. But that being said, this is a 45% of the total physicians analyzed. So 162 analyzed, 73 clinicians completed the survey, and their results were included in the study. That gives us around 45%. And this is a good response rate for a survey study. I've done survey studies before, and usually a good response rate is around 30%. And the type of clinicians included in this study is very important because different specialties have different administrative burden. Primary care have tons of administrative burden, and they get tons of messages from their patients. And physicians who practice in the outpatient setting, that means outside of the hospital, they also have tons of administrative burden. So here they had around 83 physicians and physician assistants who work in primary care, 4 nurses who work in primary care, and 8 clinical pharmacists who work in primary care. They also had 58 physicians who work in gastroenterology and hepatology, and they're advanced practitioners or physician assistants, and 10 nurses as well who work in the gastroenterology and hepatology department. So most of the people, or like I would say more than 50% of the people who, or the physicians who were enrolled in the studies, were in primary care. And this is the segment of physicians that faces tons of administrative burden. Now they looked at the utilization, how much clinicians adopt or use these AI models. On average, each clinician used the new system for about 20% of their tasks. It looks like physicians had the choice either to use the AI to generate an answer or to skip that. And 20% of the time, they used the AI to generate an answer. And really, this depended on the role and the specialty. For example, it looks like the nurses in the gastroenterology department used the system the most. And just to give you a refresher, there were 10 nurses. And clinical pharmacists in primary care also had the highest usage. So it looks like nurses and pharmacists are using this more than physicians for some reason or another. Overall, there were 12,844 patient messages generated during the study time, which was in July until August 2023. And they excluded around 25% of these messages due to different reasons, like if the message was not in English, or if it contained attachment or imager, or the sender of the proxy was not the patient themselves, so that makes the situation a bit more complex. And it's also very important to go and look at the survey that was distributed to these physicians. Remember that we use survey, and this is like not the most accurate tools to measure an outcome, but they also mentioned the pre and post survey questionnaire that they distributed to physicians. So for example, here, looking at one of the surveys in the supplementary material, they asked physician like, how mentally demanding was the task of responding to a patient message? How hurried or rushed was the pace of responding to a patient message? How hard did you have to work to achieve your level of performance responding to a patient message? And then they ask also questions about the burnout and exhaustion. For example, to what degree have you experienced the following? And they ask physicians to score it from 0 to 4, 4 being the highest. A sense of dread when I think about work I have to do, physically exhausted at work, lacking an enthusiasm at work, emotionally exhausted at work. So they ask physician, hey, like, how much do you feel these emotions? And they ask this question before and after utilizing the AI model to answer patient-related queries. And also they ask physicians about the utility. They ask the physicians before using the AI, in your opinion, what is the likelihood that AI-generated draft replies would be useful and decrease the time of tasks to respond to patient queries. And after the using AI in drafting this, after the time spent in the study, physicians were asked to, based on your experience using AI-generated draft replies, please indicate how much you agree or disagree. Do you agree or disagree that the AI-generated draft replies were useful? The AI-generated draft replies decrease the amount of time it takes to respond to patient messages. The AI-generated draft replies improve the quality. So it's mainly like more quality improvement project. They ask physician, hey, like, do you feel burnout after using the AI? And before using the AI, do you think that this AI will decrease your burnout? This is just to simplify it. That being said, they also used some objective measures. They used some terms in their study, and they measured times like action time, read time, write time, and other times. For example, they defined action time as the time between when the user last viewed the message and when the action on the message was initiated. I might see the message today, I might answer it tomorrow. So that the time difference is called the action time. And they also used what they call read time. They defined read time as the measure between when the user last viewed the message and when the user clicked start with draft. and start blank reply or even reply to the patient. And they also defined write time. It's the time between when the user clicked start with the draft and when the reply was sent. So they have some objective measures in the study. This also helps to validate this study in real world because it's not all subjective based on surveys. Now coming to the results, they were very interesting. Physicians said that and actually based on those measurements, there was no significant change in the time clinicians spent on various tasks, reading, writing, or other actions, whether they used AI or they did not use AI, because they used very objective measures of this time because they can track when the physician see the message, how long does it take the physician to type the message and answer the message. So whether you use AI or not, the time is the same. But the difference is that clinicians reported significant reduction in their task load and work exhaustion. Physicians felt less burnout, and this is very interesting. It is just like being invited to a dinner versus prepping the dinner. You will spend 2 hours in the dinner no matter what, but you will feel less tired if you spend these 2 hours only tasting food versus if you put tons of mental energy on what to prepare, what to cook, and then you cook the food and then you had the food. It is the same concept here. Because the answers were generated by an AI, physicians only needed to make small adjustments here and there and make sure that the answers were clinically accurate. And that helps physicians and relieve them from spending mental energy on administrative tasks and spending more time in creative tasks like how can I treat my patient? What type of treatment I should choose for them in the context that they have XYZ medical comorbidity. And that's where AI comes in. And that's what makes me excited about AI a lot because we do tons of administrative and repetitive tasks that doesn't require the 16 plus years of education that a machine can do in a very good way. And we have to be supervisors of the machine because the human touch still needs to be there. I hope you enjoyed this episode. This is the first of many episodes coming about different AI studies in healthcare. If you like this show, please hit the like and the subscribe button and please leave a comment. That will help me to spread the word. And I will see you in our next AI paper.